Well, first of all, I think that I'm a veteran myself. I'm very proud to have served. I'm very proud of what the service has taught me about personal responsibility and accountability and discipline when it comes to personal lifestyle and the like. I think the aspiration of, I would like to believe, every veteran is to harvest those very best ideas that they took out of their uniformed service and apply them to their civilian life. I think we bring to the American landscape, I think, a tremendous amount of talent and experience, and to do that, we really need to promote our function as full citizens. And if we're burdened by pain or disability that derives from our service or from other, just life in general, we need to apply some of those practices and some of those insights that we derived in service. And to quote from the warrior ethos, to not give up and never accept defeat. Well, in doing that, I think when approaching pain, if that's the principal focus of concern, you need to understand that there are a lot of very innovative approaches that are now being undertaken within the Veterans Health Administration as well as the DoD to approach your pain, to manage your pain. They're gonna lie in many cases outside of conventional surgery or drug-based practice. In fact, what we're learning increasingly is to be very prudent and circumspect about about jumping right to surgery or jumping right to the use of especially addictive drugs, and to explore with an open mind some of the other practices that are out there that your team of pain specialists can provide for you. And they may involve some kind of uncomfortable things that you're not very familiar with. Concepts like practices that come out of Eastern medicine rather than conventional European-based and American-based Western medicine. But be receptive to it and see how well, as an experience of managing your pain, that works for you. It's worked for so many of us, and I'm very encouraged that we're beginning to blend these practices together. I think as we learn more and more how the brain operates, as we learn more and more about the genesis and sustainment of pain and what keeps it going, we're going to learn how a wide variety of practices, not just conventional surgery and drugs, but these other not so conventional, so-called complementary practices can be integrated together, for your benefit. So I would encourage you to hang in there and to be creative and open-minded about how you approach those.